with the North Carolina 4-H Horse Program. And today we're going to talk to you about the dangers of equine cardiovascular disorders. In this presentation, we will cover heart basics. Julie will talk about her story and how it encouraged her to learn more about the equine heart. And we will also talk about 3 major cardiovascular disorders. The first thing you should know about the equine heart is that it is necessary for pumping oxygenated blood throughout the rest of the body in order to keep it working. The heart consists of 4 chambers. These are the left ventricle, the right ventricle, the left atrium, and the right atrium. And these are the pumps of the heart. The heart also has 4 valves. These are the mitral valve, the tricuspid valve, the pulmonary valve, and the aortic valve. And these are necessary for holding blood in its appropriate chamber until it is ready to be pumped throughout the body. A system of electricity is responsible for causing the heart to pump blood throughout the body. This system has 3 main parts: the sinoatrial node, the atrioventricular node, and the His-Purkinje system. The SA node is the pacemaker of the heart, and it is responsible for sending out the electrical impulses that cause the heart to beat. From there, the impulse travels to the AV node, which is a gateway in between the atria and ventricles of the heart. The AV node pauses the signal so that the 2 chambers do not contract at the same time, and the loud dub of the heart can be heard at the appropriate interval apart. Finally, the impulse moves through the His-Purkinje system, which is a network of fibers that causes the ventricles to contract. We can see in this animation how the electricity moves from the SA node to the AV node and through the His-Purkinje system before restarting. In the summer of 2013, I was diagnosed with an AV nodal random tachycardia, which is when the electricity in my heart formed a circle, taking the impulse past the AV node multiple times and causing my heart to beat before it was finished refilling with blood. That August, I underwent a catheter ablation in which doctors placed a wire into my heart and were able to burn out and block this electrical pathway. Thankfully, today I am recovered from my condition, but it inspired me to learn more about cardiovascular disorders in horses. The most important thing you should know about cardiovascular disorders in horses are the symptoms. These include loss of body condition, as shown by dullness of the coat or weight loss. Other symptoms include intolerance to exercise, shortness of breath, cough, and signs of fluid accumulation in the abdomen. If you suspect your horse has more than one of these symptoms, you should talk to your vet. Your vet may check your horse for heart murmurs. He or she may do an ECG or EKG, and they may also do an echocardiogram. You mentioned a heart murmur, Christian. What exactly is that? A heart murmur is the normal movement of blood heard throughout the heart. It is graded by sound and cycle from 1 to 6, and is caused by leaks, obstruction, and miscommunication through the electricity in the heart. You also mentioned an ECG and echocardiography. Can you tell us a little bit about those? I sure can. An ECG, also known as an electrocardiogram, checks for electrical impulses in the heart. Electrodes, as seen here and in this picture, pick up electrical impulses and send them to the machine. This machine will then translate those impulses onto a strip of paper, which your veterinarian can then read. An echocardiography, on the other hand, is different. It's a fancy word for an ultrasound you may have seen your vet use. It works using high-frequency sound waves which travel into the horse's body and bounce off muscles, tissues, and bones. These sound waves then travel back to the machine, which translates it into an image. Some sound waves travel farther than others, and this shows a greater distance. There are many cardiovascular disorders, but in this presentation, we will be covering the 3 most common. The first is a congenital disorder called ventricular septal defect, also known as VSD. VSD is a hole in between the ventricles which causes a disturbance in the blood flow and an increased heart labor. This can also cause death in some holes. Symptoms for VSD vary depending upon the size of the hole, but many veterinarians can agree that a common symptom would be little to no tolerance to exercise. Your veterinarian may use a heart murmur, usually grade 3 and above, and an echocardiography, where he can go in and image the hole to diagnose your horse with VSD. Unfortunately, VSD has no specific treatment. Horses with small holes can live happy, healthy lives with little to no athletic effect, whereas horses with larger holes have a greater athletic effect and may require surgery going to talk about today are atrial fibrillation and valvular heart disease. Atrial fibrillation is very similar to the condition I described that I experienced, as it deals with the electricity in the heart. In atrial fibrillation, clusters of cells around the atria begin acting as the SA node and releasing their own electrical impulse. This causes the electricity in the heart to become disorganized and reach the AV node at different times, causing the heart to beat sporadically. You can see in this animation how in a healthy heart there is one direct path from the SA node to the AV node, but in an atrial fibrillation heart there are many disorganized signals reaching the AV node at different times. We can see the wavy pattern caused by atrial fibrillation in this ECG. There are no set causes for this condition. However, many horses may develop atrial fibrillation as a result of an electrolyte imbalance, specifically potassium or magnesium levels. It may also be caused by high input from the vagal nerve, anemia, or deformed heart chambers, specifically an enlarged atria.
What are the symptoms of atrial fibrillation?
Symptoms of this condition are very important to look out for to diagnose the disorder. These include poor performance, such as a loss of stamina or lethargy. They also include a persistent cough, nasal discharge, or an irregular heartbeat. Your veterinarian may use this heartbeat to diagnose the condition, and they may also use an ECG or echocardiography to officially diagnose your horse with atrial fibrillation. They will then most likely administer a drug called quinidine, which helps the SA node to take control of the electricity in the heart. Quinidine can be administered intravenously or with a stomach tube. However, it is toxic in high amounts. For horses that are particularly sensitive to the drug, electric conversion is available. This is when a wire is inserted into the atria and a shock is delivered in time with the normal heartbeat. We can see in this ECG how the wavy pattern indicating atrial fibrillation disappears as the electricity is administered. These treatments have been very successful, with an 80% chance of recovery and only a 60% chance of recurrence. But it is important that both you and your veterinarian look out for the symptoms of this disorder, particularly within ages 5 to 15, when the disorder is most common, to ensure it can be treated promptly before it develops into something more serious, such as heart disease. Our next disorder is valvular heart disease, which is a thickening or deformity of the heart valves. This causes the heart valves to not close properly, allowing for blood to leak backwards into the previous chamber, called regurgitation. This regurgitation then leads to inadequate blood flow and extra strain on the heart. There are many causes for this condition, one being infection, specifically valvular encephalitis, which is any infection that causes an inflammation of the heart valves, then causing those valves to not close properly. Another cause is natural scarring of the heart valve as the horse ages, along with tearing of the leaflets, ruptured chordae tendae, which are the string-like structures seen in the picture that help the valves open and close, or a deformed heart, which is pictured as an enlarged left ventricle. Each of the 4 heart valves can leak, the most common being aortic regurgitation. This is generally a slow-developing leak that results as a horse ages and their heart valves naturally scar. Due to its slowly progressive nature, many horses with this condition have time to adjust to the backflow and may live fairly normal lives. Mitral regurgitation is also very common, though this condition causes a backup into the pulmonary veins. If this regurgitation develops suddenly, this backup can cause dangerous pressure and leakage into the lungs. Tricuspid regurgitation is very rare and usually not a problem. However, pulmonary regurgitation is rare still, yet the most lethal. Pulmonary regurgitation blocks adequate blood flow into the lungs, resulting in inadequate oxygenation, heart failure, or a shortened growth prognosis for your horse.
What are the symptoms of valvular heart disease?
That's a great question. The symptoms for this condition also include poor performance, such as loss of stamina or exhaustion. They include a persistent cough, excess sweating, venous distension, which is pictured here as a bulging of the jugular vein, or an irregular heartbeat and heart murmur. Your veterinarian may use this heartbeat and heart murmur to diagnose the disorder. They may also use echocardiography to actually image the heart and determine where exactly the leak is occurring. Unfortunately, there is no cure for this condition. However, horses with slowly developing regurgitation may live fairly normal lives with a diet and exercise program along with strict monitorization from a vet. Horses with quickly developing regurgitations, however, may require euthanasia to avoid any future complications or discomfort in your horse.
In review, we covered healthy and unhealthy hearts. Julie talked about her story and how it inspired her to learn more about the equine heart. And we also talked about 3 major cardiovascular disorders.
These include ventricular septal defect, which is a hole in between the ventricles, atrial fibrillation, which is a malfunction in the electricity of the heart, and valvular heart disease, which is a thickening or deformity of the heart valve.
If you want to know more, you should talk to your vet. Also, talk to your vet about keeping your horse's heart healthy and know the signs and symptoms of heart disorders.
These include loss of body condition,
Intolerance to exercise, cough, and shortness of breath.
We've gone into a V-fib. We're going to shock this again. Let's go bullish to 250 this time. We are set and charging. I'm going to need assistance over here. Clear. Normal sinus rhythm.
Pulse 69.
We're clear. Thank you.
We'd like to thank Dr. Sally Vibrett and Miss Cricket Gentry for their medical advice and use of equipment. We'd also like to thank UC Davis Veterinary Medical Center on their article, The Horse Report.
Also, special thanks to Dr. Matt Durham for his article, Common Cardiac Diseases, along with institutions such as Tufts University and Johns Hopkins Medical Center for their informative website.
Thank you. Do the judges have any questions?
What type of horses would you commonly see AFib in?
The question was, what type of horses is atrial fibrillation most seen? And the answer is, often it's seen in horses with high work demands, such as racehorses and draft horses.
Some of these conditions, some horses can be born with, others could be developed over time. You mentioned about keeping your horse heart healthy. What are some things that we can do to keep our horses healthy?
The question was, what can we do to keep our horse's heart healthy? For this, I would say regular vet checkups to keep your horse. Also, a good diet plan and a good exercise plan would all be ways to keep your horse heart healthy.
What type of muscle is the heart?
The question was, what type of muscle is the heart? And the answer is, it is actually a cardiac muscle, as there are 3 types